In case you haven't heard, America's medical industry is pretty effed, but it doesn't have to be. Welcome to Right to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around.
So today we are here in Sevilla, Spain, and we are at Dr. Raúl Pascual's dental clinic here. I have my dear friend Felix, who is going to help with the translations. And we're going to learn a little bit more about Dr. Raúl and the health system here and how it applies to dentistry, the educational pathway to being a dentist as well, too. And so I'm really grateful because he's come on a holiday to do this recording with me. So welcome.
Thank you.
Yes. So I'd really like to know about your journey to dentistry. When did you decide you wanted to become a dentist?
Bueno, pues la vocación ha sido muy curiosa en mi familia porque nadie...
The whole point.
He's the only one that's in the family, correct? That has anything
he's
to do
the
with
first
medicine.
one, and he's been really good with hands in soft and delicate jobs. So he became a very good friend of the family dentist, and then he realized that that kind of job was suitable for him.
And what does that look like through the education?
Vale, en aquel momento la posibilidad de estudiar odontología...
Basically, when he started many years ago, in '92, the public system was starting with the dental career as separate from the medicine studies. As I told you before, you had to follow medicine 6 years, then 3 years of specialization. So to become a dentist with a titulation, you need 9 years. So it was crazy because at the end you even forget that what did you want today when you started. So he started in the new system. The new system was you could follow dental studies, but there are few places to study here in Spain, and the selection was just for the very best of them. Few places. A lot of people applying to come in, so people have to look for some roundabouts. First one was going to Dominican Republic, who had signed an agreement with Spain that you could follow studies in Dominican, which was faster and easier, and except you have to be there.
That's very unusual because
No, it's not uncommon that Spain signs agreements with crazy countries for a few years to do some studies, and that apparently it's something to after United Nations recommendation to rise the level of the studies, since language is not a problem in that kind of countries. So it's not. But when he started, that stopped. So since there were no private universities that you could get in with money, he started in a private university in Portugal. But it was a bit crazy because it was full of rich sons of dentists of Spain and then from Portugal, and the level was not the best one, and there was many ways to waste your time and your money. So he came back and tried to raise the level, his level, to become part of the public system in Spain. He got it.
Okay, all right.
So it wasn't easy then.
What is the investment from when he graduated? How much did college cost? To what does it cost today for a dentist to get the education to be licensed?
Porque ahora cuando tú apruebas asignaturas, el siguiente año solamente con aprobar...
In the public universities, you have to pay a fee for each subject of the year. It's like 1,000 roughly, 1,000 each subject. So every year could be among 5,000-6,000 per year. That doesn't cover the whole system. It's just a fee to say, okay, this is not completely free.
Sure. Yeah.
So it's barely the cost per year. But if you are good, if you pass your subject, then it gives you the possibility that you don't pay for one of the subjects in next year.
Okay.
If you are a good student, you pay nearly zero.
Wow.
Not even the fee.
In America, dentists are coming out with between $300,000 and $500,000 of debt for some of the schools. And since 2010, it has raised almost 90% for what it costs for the education. So in 2010, it was significantly less. And now, again, like I said, they're coming out with up to $500,000 in debt. And so that's another reason I want to shed light on this topic is it's becoming more and more difficult. Doctors are telling their children, please don't become a dentist, please, and because the amount of debt that they're coming out of and how expensive it is to run a dental office. So it's really it's sad. It's a problem. And then the privatized insurance aspect of that as well too. And so shedding light on the public health aspect of it, because we have everything in America is privatized, and I don't think that there's going to be a perfect solution for universal health or what it may cost citizens to do anything. But what we have right now is it's not working. Where people, again, they're deterring their family members from becoming doctors because of this, and the debt, and then the privatized insurance. In 1974, you would get, if you paid for dental insurance, you would have $1,000 to last you the whole year. And that is still the average 50 years later today is people are getting $1,000. And we know something like a dental crown or a dental implant can be thousands of dollars. And so it's almost like an annual coupon. And that's how I feel about it. I've been in dentistry for 20 years, starting out as a dental assistant. And it was always just mind blowing to me about the insurance and how much they deny as well, too. And so, yeah, having something that is the same as 50 years ago doesn't go very far here to this day. So as far as the upon graduation here, do you have to register yourself within the public health in the government to start billing them?
Para poder ejercer, tú después de la
Professional
facultad,
association that controls and protects all the associated against the suits, and that association used to have a recommendation on tariffs for the different works. Not any longer, so that association yet doesn't get involved in how much are you going to cost to charge in your work, but the basic of these colegios, we have colleges in engineering, architecture, and so it's a way of the professionals protect themselves against things and to pass information, of course, among the professionals. So you have to be member of the colegio. The colegio it's an association to practice.
es obligatorio además, ¿eh? O sea,
So it's mandatory.
Is there, we have continuing education credits for any sort of licensed professional. So on an annual basis, they have to continue their education and receive a certain amount of credits to keep their license active. Is that something here?
nada.
No.
If your own interest to grow.
Yeah.
Okay. All right. So the public health system here, as far as, does it cover pediatric care? What does it look like? What does the government pay for anything dentistry?
Una cosa antes que está comentando que me parece interesante es
He's come back
cuando tú
on
terminas la
information, and now there's a movement on the profession, on the different professionals to get some specialization and title, so you can practice say on the endodoncy, and you're specialized in that, and you practice that. Yes, that you don't make implants, say, or you do some other things, and this is something they are moving towards that. Now you just finish the career, and you can do anything, and you can say you can do anything even if you have not done that along the career. So they are trying to get some specialization and formation on that specific. There are two systems. One if you're under 14 years, national health system pay the dentist an amount for a child who is dealing with. The amount of the money is very short.
Okay.
If you have little number of patients, maybe you are interested in having many children because as many you have, you are getting more money. If you have enough patients, you are not interested in participating in this collaboration with the national health system because they practice here in the private clinic, and then they pass the bill to the national health service, and they pay you in 2 years and very little. So it's nothing really interesting for a dentist to become part of this.
How long does it take for them to pay?
Well, they pay you very little, and they pay you at the end of the year. So it doesn't pay. No, it's not. So you made the expenses now, and you waste your time. You use your time now. Well, now we are in December, maybe.
Yeah, right.
But if you could be waiting many months before you get back a little money, and then there is another in the national health clinics. You can go and apply, but it's slow, and there is a few catalog of services there as well. So
terrible.
There's not a wide support for dental health in the national service.
What is that in comparison to overall health, like your medical for the public health services here?
Maybe between 5 and 10% of the issues you need in your health, dental health, is covered by the National Health Service. You have to normally you just go to a private.
Okay. That just sounds like the health here isn't that much different. Do you think that creates a barrier in care for the overall dental health for even children? If families, can they afford it? Is there education that they should be getting that prevention on an annual basis?
Ahí hay un debate importante porque realmente después de...
People with little incomes, legal little incomes, are always complaining. I can afford this, and as I say, yeah, okay, you can afford it, but you have an iPhone last model, and you got parked a BMW there, and at home you have 7 different big size TV. So you've got your priorities, and you want to spend your money in what you want. And it's just when it hurts when you come and say, oh, well, I don't have any money. I'm in the unemployment queue, and I have just receiving this little. No, you're not receiving this little because you have a ¿cómo se dice? Economía sumergida.
That's very common.
You get your money outside of the system, but you get enough money. So poverty exists, and there is a lot of people under the basic income, but it is not that uncommon, that usual. And normally there are some associations always working on those special.
Okay. It sounds very similar to the United States, and we have public health services that make sure that children from the time they're born until 18 years old that they have a coverage. I think actually maybe 19 in some states that they're oral health, but even then it's treated very palliative. It's an uphill battle of trying to educate people on it's going to cost you a lot less to take care and prevent anything than waiting until all of a sudden it hurts, and then there will be times if a patient needs, say, a root canal and a crown, and they, like I said, there's only $1,000 that their insurance will cover up to if they have it. So they have a couple $1,000s that they would have to pay, and patients will say, "Oh, we're buying your big mansion. We're paying that for you," and you're driving a BMW yourself. So it's terrible. So tell me about your practice here. How did you become an owner for the dental practice? Did you have to work for anybody first? And then what does it look like for the employees that you have here?
Sí, yo cuando termino la carrera, en el año 90,
When he finished, he became part of the dentist who inspired him, the family dentist.
Okay.
He could, along the career, along the university, he could do some practice in there, just looking, but it gave him a real scope of what people were asking on private system and in the people who they treat in the faculty, because they treat people from the second year on. They treat real person on the university, so they had practices with real persons and on the university, but it was different from what was happening on the street. So he was lucky because he knew the profession really well when he started in 97 under this elder professional, the elder dentist. So he spent 12 years and he jumped and gave the big jump of and started his own business. And he realized that running a business is something different than doing a good professional. So you need business scope.
Yes.
So he make a 1 year, I think it was un año, in San Telmo.
un año, sí.
Yeah, he spent 1 year in a business school just learning how to run business.
Wow.
How to manage the billing people,
Yeah.
managing the taxes, managing the business vision. So running business. So this is price because it's not cheap. I know sometimes it's not cheap. This business
No.
is
12.000 euros.
Well,
this business so it makes not only an innovation on time but in money, because he wanted to be not only a good practitioner, a good dentist, but running the business, because as he said, at the end of the 80s and early 90s, dentists get a huge boom here. They earn a lot of money, but as they didn't have any scope of the business,
similar to
they
dentista.
many of them got in bankruptcy even. So
Yeah.
he was aware of that, and this is not going to happen to me. I'll make some investment in my own formation, not as a dentist, but as a manager. So
Very, very smart. I mean, that is, I say it all the time. So, my work, I'm a practice management consultant. So, I go into dental offices because the dentists and different doctors, they learn to become great dentists, but they know nothing about managing their business and managing their people. So, they actually will hire me. And it probably from the beginning, if they went back and got some education in business management, they probably would have been better off. But then they go down this road and trying to manage other people and their finances. And sometimes I have to come in and be the bad guy and say, stop spending your money. You're being a jerk to your employees. You can't treat people this way. So it's all too often coming in and it's so far advanced. They get out of school and they just like to spend all of this money and buy all of the really great things. And they have employees that they can't keep. They're not running their business. And so I come in and I'm very direct with them and letting them know, like, you're the problem, and it's okay because it's a broken system. You should have learned more about business and how to manage people, which is in communication and yeah, the taxes. And so, oftentimes when I come in, it probably costs them more money to hire me than it would have if they took a year of business classes.
Es que eso yo lo vi claro y
So it's coming back on the same idea that you have to be in both sides of the business. You have to be a good practitioner.
Yes.
And you have to be a good business manager. Because otherwise, it's just you're getting the money and you think this is all mine. No, this is not all mine. You have to pay for the survey. You have to pay the employer. So you have to pay many things from the money they are on the top of the table.
It is. I have to teach the insurance side of it as well too, and I tell people 100% of practices that I go into, there's some level of insurance fraud that's going on, and doctors have no idea. Oftentimes, it's because maybe they're being compassionate and they're providing some free dentistry to a patient, saying, "We'll only take what your insurance is going to pay for," and that's considered fraud. And they think, "Well, I'm just being nice." But they don't learn any of this at all in university of what could really get them into a lot of trouble. And so it's
the same here.
bad.
You don't have any business education in the university. Yes, dentist, but you have to run it and to run your business.
How many times are there dentists that go and get that extra education, or are you unique to that you decided that was a smart idea?
Muy pocos, ¿no? Muy pocos. Very few.
I
Very
assumed that.
Very few.
Yeah, I would think so as well.
Can tell you, and not only that. This is. I'm sorry. I'll make just parenthesis.
No, don't apologize. This is great.
Here, it's very common to open. I want to run my business. I'll open a bar. So I'll open a bar because I'm quite good in bars.
Yeah,
I'm quite good.
You can make the drinks.
Yeah. But you don't know how to run a business, and maybe you have a successful bar for 2 years.
Yeah.
And since you don't have any idea of how to run business, in the third year you are
just thrown into it.
So that's very common.
Yeah, it's common. Well, and it's common where
you
we're
want
from.
to be in business, so you learn how to run business. So that's it. He has quite a good vision.
Yo recuerdo que cuando yo fui a San Telmo,
growing management. So I'm growing. He was aware of I'm growing, and I don't know how to manage the growing. So that's what really compelled him to the business school.
I think that the humility is so important. There's so many younger dentists or doctors of any sort that are coming out, and they want to be. Everybody wants to be the best of everything, right? But they don't realize that humility to say, I want to be better. Like I don't know what I don't know. Yeah.
Yo además,
That was
yo empecé aquí.
just humility, saying I don't know how to manage this, and I have to learn how to manage this.
Only through person.
Yeah, it's excellent. Do you think a lot of the when younger dentists are graduating now, do they have some of that humility to even admit that they don't know how to run a business? They may not go back to the education, but will they even say like, "Oh, I might not be good at this"?
No sé si van a tener la humildad.
Not connected with humble, but with need. So it's changing. For example, to me, it's quite a surprise that he's got the decision to go to business school. Because normally people who attend the business school is because the company send them there. You have you are running this branch of my business, so you have to learn how to. So normally the basic public who attends business school are just big companies or big companies who send the employees. That's changing. I'm contacting people who just say, I don't know how to run my business. I need to and go to this business school. So this is something that slowly but steady getting into the mentality of people opening and getting business.
That it is great, because I tell doctors all the time too, is it's not your fault. Again, you wanted to become a dentist and you don't know how to run a business, and on top of it, when you're graduating with $500,000 in debt, the last thing you want to do is go back and get more education and more debt so that you know how to run a business as well too. So it's a really conflicting situation, and again, something that really should change for doctors in America. Oh yes, the doctors, when they're graduating with $500,000 already in debt from dental school, the last thing you want to do is get more. So my final question will be, if there is anything that you could do to change the public health aspect of it here for the residents so that it would increase that prevention of the care, what would be something that you would change about the public aspect in how they cover dentistry here in Spain?
Hay bastante formación
So
en los colegios.
this basic point on national health and what can be improved is in some ways it's now because there are many campaigns on the schools passing information to the kids. How important is to take care of your dental health and how to clean well. So now people now with teenagers and are much more aware of the dental health that I was when I was a teenager or even in older.
Y yo también, o sea, yo cuando tenía nada más que iba al dentista cuando me dolía.
Then we just came to the dentist when there was a problem and it was late and was just and even the doctors then just take out the piece. So it was not a prevention and some. This is going to be a higher, bigger problem if I take out the piece and try to repair it, try to keep it. So it's campaigning and warning the population. So this is what the national health can do regarding dental improvement of population, and it's a bit on its way.
It's moving in the right direction. That's great. Yeah, no, that is really great. Well, again, I am so thankful for your time, especially around Christmas, that you were able to spend some time with me and agreed to do this podcast. It's really important to educate Americans and hopefully globally, on the different health systems and what we need to change and focus on prevention.
Nada, para mí es un placer y la verdad que, bueno, hablar de lo mío me gusta mucho, así que no me cuesta ningún trabajo ni ningún problema. Además, hablo mucho como los dentistas.
He likes to speak and he likes his profession and he is really, really fond of passing information he's got. So
this is great. Yeah. Thank you. Gracias. Thank you so much. Yes.